Good afternoon, and thank you for joining us for this Facebook Live chat today. Did you know that pain affects more Americans than diabetes, heart disease, and cancer combined? It is also the most common reason Americans access the healthcare system. Now, September is Pain Awareness Month, an opportunity to do exactly what we're doing today. It's giving the facts on pain and pain management in an effort to educate and also support those who deal with pain. Now, joining us to talk about pain and pain management is Dr. Michael Massey. He's the medical director of CentraCare Neurosciences Pain Center. It's a new center here within CentraCare, and he's going to answer some questions that you have about pain, so you can feel free to comment if you'd like. But we've got some questions already ready for him, so thank you so much for joining us today. The first question is, pain feels like a very broad term, anywhere from a headache to chronic pain. So how do you at the Pain Center define pain?
Sure, and you're right, it is a very broad term. And most of the time, we allow the patient to define it for us. We know pain is a very personal experience. It's a very unpleasant experience that's usually associated with some sort of injury, but it doesn't really have to be. It could just be some sort of experience. It's the patient's, it's the patient's pain. And so at the Pain Center, when we see patients, we sit down with the patients and they just start talking to us and we listen. And they describe their pain as sharp, burning, aching. And we take that information and we will do an examination, and we might run some tests and come up with our own, possible reason for someone who has this experience and has this pain, and come up with an idea of why they might be experiencing this. Try to make sense of it. Usually, when we meet with patients, it's always a different angle. Everybody has their own angle on pain, but the main thing is it's a personal experience. It's unique, and it's theirs. And it's a new description every time we meet with patients.
Specifically, the Pain Center deals with people that do have chronic pain. What is chronic pain?
Great question. Chronic pain is pain that's there that really shouldn't be, or maybe it's there a lot longer than it should be. So you might have a patient who had some sort of injury. Maybe they broke an arm or a leg, something like that. And then after it heals, the pain's still there. I mean, what do you do with that? And so it's, again, when we talk to patients, the way they describe it to us is it's just always there. It lingers. It really kind of takes a major toll on their whole life. A lot of times their mood starts to suffer. They're not really sleeping. They're miserable. They're always in pain. And it's something that they kind of have to deal with. The main thing that we try to emphasize with patients is that with chronic pain, you have to treat it a little bit differently than other types of pain, because most of the time what really helps is really managing symptoms rather than trying to find a cure.
Okay. Well, what types of options are there to treat pain? Are there non-pharmaceutical options?
There are many options out there on how to treat pain. You have your traditional treatments, which are medications, injections, sometimes surgery. But I'm telling you right now, especially when it comes to chronic pain, a lot of times the best tool that patients have to treat their pain is really between their ears. It's their noodle. And the thing is about it is it's really important that patients buy into that and explore ways they can use their noodle to actually treat their pain. And so a lot of times we'll refer patients to wellness programs where they might experience things like mindfulness, biofeedback, all these complementary and alternative treatments that really help patients with pain. We offer the traditional treatments, but there's a kind of a common belief out there that you need to find the right cocktail of meds or the right shot or the right surgeon. That's how you treat your pain. I'm telling you right now, that's how we're structured right now in healthcare. But most of the time, from my experience, that's really not the right way to go. The right way to go is you sit down with the patient, kind of really get an idea of what they're experiencing, and then come up with a personalized care plan that really works for them and helps them meet their goals, help them improve their lives.
So you kind of answered that question already, but what does the Pain Center do to help patients living with pain?
Right. So We're very lucky here at CentraCare. So we have a team. We have a team at the pain center who, we've everybody on our team has actually experienced pain in one way or another, and so we kind of bring our own personal experience and we relate to a lot of the experiences that patients go through, but we use a team approach at the pain center. So I'm a physician. We have nurse practitioners. We have pharmacists. We have physical therapists, and a lot of times they'll meet one-on-one with them, and they'll kind of get their slant on things, and then we'll meet as a team, and we'll discuss what's going on with the patient and kind of get an idea of the best approach. And what's different about what we do compared to most other institutions is that we all sit down and talk to each other about what's going on with patients. And I'm telling you right now, the team approach where everybody weighs in on what's going on and comes up with a treatment plan that's unique and individualized for the patient is a much better approach than seeing a bunch of people that don't really talk to each other, because a lot of times they get mixed messages that complicate things. It's really important that patients that are experiencing these things that a lot of times impacts their life have a unified, consistent message that will bring them towards recovery.
You talked about having experience with pain and the team having people that have experience with pain. How important is that empathy factor, that you can look at your patients and know that you've been there?
I think it's huge. I know personally, so I have a bum back. When I was 16, I hurt my back. I went to the doctor. He gave me some ibuprofen. He said, you'll be fine. And then I wasn't fine. And then about a month later, I went back. Said, all right, go see the surgeon. And I went to go see a surgeon, and he said, okay, we'll do a surgery on your back. 16. And I was looking at him, I was saying, what are you talking about, man? And he said, no, we'll do a surgery. And that just wasn't in the cards for me. And so I rehabbed it, and it got better. And then a few years later, it happened again, and again, rehabbed it. A few years later, hurt it again. And, I was in my 20s at the time when it was really bad, and people just don't understand. People that don't have pain, that have never experienced the debility that comes with pain, like long-term pain, they really don't understand. And I think it helps a lot to talk to somebody who can kind of pull from those experiences and just kind of talk about what helps, what's helped them. And so I know I share my experience with patients all the time, and I know that other members of our team, they also share their experiences, and patients, I think, appreciate it.
Great. Well, what advice do you have for people who may be having surgery coming up and they're worried about becoming a statistic?
So it's very important that when a patient's about to have surgery, that they sit down with their surgeon and have a very frank conversation. You really need to identify what the goals are of the surgery, and especially if it's for pain. And you need to discuss how realistic is it that if we do this surgery that we're going to accomplish the goals that we've set for this. Because if you have surgery and you don't really define what the goals are, you don't really understand what the goals are, you can actually cause more harm than good. Again, what's great about CentraCare is we have great surgeons, and they're very good at sitting down with patients and discussing these things with them so that patients understand the reason they're having pain and the reason for the surgery. Because if you don't really understand that, then you don't really know what you get yourself into, and I don't think that's good healthcare.
So one question that is definitely on the topic of mind in the news is opioids. So when it comes to the pain center, people will probably come and ask you, are opioids safe, or how can you use them safely?
Sure. Opioids are a hot topic, and they've been a hot topic for the past few years. And the message on opioids have really changed throughout the years. Not only like 20 years ago, the message was, if a patient's in pain, give them opioids. And now 20 years later, the message is, if you're in pain, don't give them opioids. And and patients have received that message for a long time, and so now the message has changed. So there's a lot of concern there. As far as addiction goes, that is one of the risks of opioids, and I think it's healthy to kind of have that in the back of your head. Man, I gotta be careful about that. So we're very at the pain center, we're very concerned about the safety and monitoring of opioids. I think it's very important to have an end game in mind. How long am I going to be on opioids? Hopefully it's not forever. That's not the goal here. The goal is to really help you move towards recovery. So should we never use opioids? I don't think so. You just use opioids when it's appropriate. And it's very important that there are monitoring procedures when using opioids, so that way we keep patients as safe as possible. And if we identify any signs that they could be becoming addicted, then we deal with that. Then we talk to the patient about that, and really try to move them towards a place where they don't become addicted. And so we're very concerned about that. And we actually have a pharmacist who her specific task is the safety and monitoring of opioids in the pain center.
When should someone see a pain doctor, or how can someone go about seeing somebody from the pain center?
Sure. So I think the best time to see a pain doctor is when the usual treatment for an injury, it just hasn't worked, and it's been a while, and it doesn't work. Another time to see a pain doc is when maybe you've been in pain for a while and you've been getting a treatment for a while, and it's just not working out. Happy to see a patient, happy to kind of take a second look and see what we can do to help. You can always contact the pain center, and we have a nurse who kind of triages issues and why, what's needed here, and then we kind of help put them in the right clinical pathway. And so a lot of times we're doing triage. We kind of see patients, and we'll determine, will this patient do better with surgery? Should we just do physical therapy? Should we do meds, or should we do more of those complementary treatments that we discussed earlier? And so we do a lot of triage in the pain center to kind of put them on the right clinical pathway. And we're honestly happy to see anybody anytime.
So you don't need a referral to come to the pain center necessarily?
I don't think so. Great question.
That's a good question.
Great question. We're moving towards, if we're not there already, and I think we're there, but I'm not sure if we're there already, we're moving towards a patient can come to the pain center by just calling in.
Yeah. Okay. Well, my last question is, who or what types of patients have the most success when they're at the pain center?
Yeah. I think the patients that have the most success are the ones that understand this is more of a marathon rather than a sprint, that they take their time. Patients that really kind of buy into the message that this is not a quick fix. This is almost like it's almost like a chronic disease where you just have to slowly start to help your manage your life, manage the symptoms in a way that is healthy. So patients that kind of have that in mind and come to the pain center with an open mind and stick to their care plan and keep in touch with us usually do a lot better. If people are looking for a quick fix, that usually doesn't work out. There usually isn't like a magic pill or a magic procedure or surgery that completely fixes patients. So people that are looking for that, they usually don't do as good as people who are here for the long haul.
Okay, all right. Well, thank you so much, Dr. Massey, for answering all of these questions. Now, if you'd like to learn more about the CentraCare Neurosciences Pain Center, we're going to ask you to visit CentraCare.com, and you can search Pain Center. And if you think you might be a candidate for the Pain Center program, you can talk to your doctor, or you can call the center, and like Dr. Massey said, they do some triage. You can call them at 320-240-7859, and we'll put that information in the comments as well. So thank you again very much for joining us. September is Pain Awareness Month. We hope we've taught you a little bit more about pain and pain management.